Assalamualaikum warahmatullahi wabarakatuh. Hello, my name is Rizky Maulana, NPM H1A020053. I am one of medical student of Faculty of Medicine Bengkulu University. So here I would like to talk about medical research. The title is The Effects of Kangaroo Care Applied by Turkish Mothers Who Have Premature Babies and Cannot Breastfeed on Their Stress Level and Amount of Milk Production. This medical research is written by Didem Coşkun, MSc, and Ulviye Günay, RN, PhD. So this medical research structures is one background, and then aims, methods, results, and conclusions. The background of this medical research is, first, prematurity is a condition that can prevent or delay formation of their mother-infant bonding relationships by delaying mothers from seeing, touching their infants. Uh, in addition, situations such as uncertainties in infants' prognosis, fear of losing infants, inability to fulfill maternal roles, and feeling of pain and fatigue and cause mothers to experience various negative feelings such as anxiety, guilt, and stress. The high stress level experienced by mothers of premature infants are among the most important factors preventing mothers from participating in infant care and breastfeeding. The inability, the inability to breastfeed can result in mastitis, decreased milk production, pain in the nipples and chest, lack of confidence in maternal roles, not feeling like a mother, and feeling of guilt, anxiety, depression, and stress. And then the second, kangaroo care. In kangaroo care, a parent places the newborn or premature infant wearing only a nappy on the parent's chest in a straight position, thereby achieving skin-on-skin contact. Studies have shown that compared with infants who do not receive kangaroo care, newborns who receive kangaroo care start breastfeeding earlier and are breastfed for longer, and their mothers are more willing to breastfeed. Kangaroo care is one of the most suitable methods nurses in neonatal intensive care units can use to decrease mothers and infant stress. Studies have explored the effect of kangaroo care on mothers and premature infants, and a few have reported that mothers who apply kangaroo care breastfeed their infants early. Then, the aims of the study. The study aimed to examine the effects of kangaroo care applied by Turkish mothers who have premature babies and cannot breastfeed on their stress level and amount of milk production. And then the methods of this medical research is, first, the samples or the mothers were randomized at 1:1 ratio into the kangaroo care group and the standard care group. Then, the mothers in kangaroo care group applied kangaroo care to their babies once a day for 3 weeks. Then, the mothers in the standard care group saw their infants for 15 until 20 minutes once a day for 5 days a week for 3 weeks, which was standard care in the newborn intensive care unit. The mothers milked their breast with breast milking machines or pumps every day for 3 weeks. Then, the result of this medical research is, first, increasing breast milk production. The breast milk production by the mothers who applied kangaroo care and could not breastfeed was found to increase gradually during the follow-up. The average total milk among the kangaroo care group was 1,000 669 milliliter in the first week, 1000 I'm sorry, 2409 in the second week, and 2973 in the third week. The average total breast milk produced by mothers who applied standard care and who could not breastfeed was 1184 in the first week, then 1161 in the second week, then 964 in the third week. The difference between in the two groups was found to be statistically significant for all the collected measurements. And then the second result is lowering parental stressor scale, or PSS. The mothers who applied kangaroo care had lower PSS, subdimension and total scale average scores than the mothers in the standard care group. In the pre-test comparison of the two groups, the difference between the means of the image and sound subdimension scores, the infant's appearance and behavior subdimension scores, and the average total score were not significant. The difference between the means of the parental role subdimension score was significant. In the protest comparisons of the two groups, the difference between the mean of the PSS total scale and the subdimension scores was significant. Then, the conclusion of this medical research. These results show that kangaroo care is very important intervention for promoting bonding between mothers and premature infants and increasing production of maternal breast milk for infants. Okay, I think that's all I can talk to you about this medical research. Thank you very much for your attention. Wassalamualaikum warahmatullahi wabarakatuh.